Ian here with Minuteman Theory, and in today's video we are out in the field, we're out in the bush, and we're going to be going over comparing and contrasting our med kits. We have Kevin here. Kevin, tell us a little bit about it.
Yeah, I'm a EMT. I've been an EMT for 6 years. Libby volunteer ambulance. I'm also a medical assistant. I do a lot of medicine. Love working with medicine, yeah.
Kevin is going to critique our IFAKs today, and we're going to compare and contrast what we have in them. This is Ian's.
Yep.
This is Kevin's, and this is mine.
All right. Who wants to go first? I'll go first.
Okay, you go first.
All right. So the initial one, we have chapstick.
Chapstick.
Just because.
Oh, goodness.
Just
yes.
because.
Oh,
right? Like, I mean, why not?
100%.
That is something I don't have.
Yeah.
I don't have chapstick either.
That is clever.
All right, now I went with this. You guys are gonna laugh, but it's the Spanker brand from off Amazon.
Spanker.
The reason I went with it is because it has two zippers, right? So if I need to open this quickly, boom. I mean, it's open and it falls down.
Benadryl.
So I have some Benadryl. I have some wound closure. So basically some butterfly bandages. I have some for stings and stuff.
Yeah. Oh, okay.
For stings.
Oh, wait, hold on. So what is?
So basically, you break the vial, and it puts the sting stuff into that cotton swab, and you swab it on you, and it reduces inflammation.
Oh, okay.
That's great.
Yeah, some Benadryl. Okay, now I have for a sucking chest wound. That's what this is for. I'm not going to open it, but it is a wound seal, basically. So if you get a sucking chest wound, there's one on each side. It says that it's one, but it's actually two. And what you do is you put it on the one, you don't tape it the whole way, and then you put one on the back and you tape it the whole way so you can burp it. So I have wound closure. I have some gloves. Now I just carry these around just because, I mean, normally in the woods I know who I'm working with, but again, and I have a tourniquet.
Wow, I have not seen one of those in a long time.
Yeah.
Yeah, that's super cool.
I like these. I like these a lot, and they're super compact.
Is that a bungee one or no?
Yeah. So basically, I'll show you here. You put it in, cinch it down as hard as you can.
Yeah.
And then you just start wrapping it. This one doesn't want to cinch real well. There we go. There it goes.
Yeah.
So then you just
wrap the fuck out of it. Yeah.
And then you put the
put the end in the
yeah,
little
right there. I'll show you. So the clip is right there.
Yeah,
you put it in.
There it is. Super cool.
I've never seen one like
Those
that.
are kind of old school, yeah.
They are, but this is what we used in the old man's army.
What works.
Yep. And then I have some tape. I know tape looks kind of grimy, but if you take the first layer off, it works. I have some tweezers, some more compressed gauze, and a whole bunch of, I'm not going to pull them all out, but I have some Excedrin, I have some Band-Aids, and I have some disinfectant. And then I have a lighter and some more just like little Band-Aids, little ouch things. And then I have an Israeli bandage.
All right. Yeah.
And more Band-Aids. I have a lot of Band-Aids in here because the one thing that I've noticed out, especially when you're out in the field or out hiking, people get small little cuts and things like that, and it's easier to just have a Band-Aid that you can just put on there. But yeah, that's my med kit.
Okay. Go ahead.
I was gonna say I like where you're at. Especially I like that you have the Benadryl. There's a lot of Benadryl there. But the one thing is I would suggest a hemostatic gauze.
Okay.
I would suggest having some type of something to pack a wound with.
Okay.
Yeah, no matter what it is, it might be even seemingly bleeding controlled, but if you have an open wound, you're still gonna want to pack it.
Okay, so hemostatic gauze. I'll put that on the list of stuff to get here.
Okay, and then I also want to ask, where do you take this? What is your use case for this IFAK? Like, do you take it just hiking? You take it everywhere you go?
Everywhere so I have two med kits in my car. I have one in the rear passenger side. That's just a secondary to this, but I have one in my car that's on the driver's side. It's in the driver's side compartment over by my leg, and that's in case there's an emergency and I need to help somebody else. This comes with me everywhere. So if we're shooting, if we're hiking, whatever we're doing, this is always with me.
Very cool.
Yeah, I would just suggest having some type of gauze.
Okay. Not a compression bandage and not compressed gauze?
Compressed gauze is great, actually, yeah.
Okay.
I didn't see that.
Okay.
This is actually really good.
Okay.
Yeah.
So, but would you still recommend hemostatic?
Yeah.
Okay. Okay.
It's fairly expensive, but...
Right.
Yeah, so
Well, I mean...
I have mine set up a lot kind of the same way. So we get into mine, I have a cat tourniquet. I have epi. I have the emergency bandage. I have the Celox, right?
Oh, okay. Okay.
Hemostatic gauze.
Oh, that's hemostatic gauze. Okay.
Yeah, so this
Very cool.
this stops bleeding fast, right? It helps clotting. I also carry around just a saline flush.
Okay.
This is great for if you get something in your eye. If you have to flush something real quick, this is really great. Coban, of course, in here. It seems a little bit redundant, but I have my fire starter kit. Alcohol swabs. These alcohol swabs, if you take one of these and you open it up and you strike your striker with a little bit of tinder, that'll start a fire real quick.
Okay.
I also have tape and a tourniquet.
Oh, okay. Okay.
The whistle, right?
Like a rape whistle? Just
Rape whistle. Yes, because I know you guys.
This is my rape whistle.
I also carry tons of meds, tons of different types of meds.
Oh, okay. Okay.
What all do you got there?
All sorts of different meds. So these are baby aspirin. These are muscle relaxants. These here are like a gastric GI type stuff. It's doTERRA.
Okay.
Actually. And then I have these are clonazepam that are prescribed to me. And then, yeah, muscle relaxer and baby aspirin. Baby aspirin, and also there's nitro in there too.
Okay.
So in the case of cardiac event, of course, nitro and aspirin.
Yes.
I have the emergency bandage. I have EpiPen, the Celox, Coban. I also have a different kind of same thing that you have with your sucking chest wound.
Okay. Yeah. Oh, that's an ash. Those are what we used to. That's what we used in the military.
Straight up.
Yeah.
Yeah. So the Asher. Yeah. So these are great because they can be really hard to apply whenever there's a lot of blood. And so this has the gauze that helps soak that up, and these are great. Tagaderm.
Okay.
What's that for?
So this is just a clear adhesive that is really good for minor cuts, scrapes, wounds.
Oh.
And it just seals everything off.
Kind of like the
really well.
bandage, the clear bandage they use for tattoos?
It's exactly the same thing.
Okay.
Exactly the same thing. And then I also just happen to have some fire starter and some deep wipes, some antibacterial wipes.
Oh, yeah.
Yeah. So mine's pretty simple, other than I'd say maybe the meds that I carry. It's pretty basic. The Celox, this is really so for any like trunk wounds,
Okay.
any
Is
type
that-
of stuff.
now,
that
is
you
that the-
can't tourniquet.
Is that the brand that you would recommend?
This is well, there's two brands.
Okay.
There's the Celox, and then there's I can't remember what the other brand is, but they're both great. Any type of the hemostatic gauze.
Okay.
This has the clotting agent in there that really helps to stop the bleed.
Okay.
And of course, can't go wrong with an IV flush.
Yep.
Now, do you have all the other bits and bobs for doing an IV, or are you just using the flush?
In my jump bag, I do.
Okay.
But not that I just carry
Okay.
with me. No, I don't.
Okay, so then, again, when do you carry this, and like what
This is
what
kind of my
situations does
EDC.
it serve?
Yeah.
Yeah, this is kind of my EDC. This goes with me pretty much everywhere. This little kit, right? I also usually have my jump bag with me, but on like hikes like we're doing today, this is what I carry.
Sweet.
All right. It's funny how we're all kind of we're all kind of in the same, you know what I mean? Same, but different. You know, the only really big thing would be the hemostat. And that's why I'm glad we had this, because it's like, I get to see what somebody who's, you know, doing this every day is carrying, and, you know, making sure that, yeah, so this is awesome.
So I try to make sure that my tourniquet is ready to go, to where if you need it, you just crank it down and then you have it, you know, of course.
Now, the reason that we have ours curated, the way that we do, is because, again, we're talking about, this is basic trauma stuff. This isn't anything that, you know, you're not going to be able to be out for days on end and do surgery and things like that. This is just one of those things where it's like, we have a problem, we need to fix it right now, sort of deal, right? Yeah.
Right. This is an emergency medical kit for when you're out in the field. Right. Okay.
Having something like the epi is a good thing, because recognizing, and there's so much stuff out here that can cause an allergic reaction that you wouldn't even know unless you were able to.
Now, I just went on a call this week of a gal who had a bee sting, and she applied her EpiPen.
Sure.
She was still starting to it was still starting to close.
She probably applied it too early.
Okay. Here's my question. Do you use Benadryl in combination with?
Yes.
You do.
Yes.
Okay.
Absolutely, yeah.
Okay. So if you're going to use an EpiPen, you might as well pop some Benadryl. It's not going to.
100%.
Okay.
So I like where you're at with the Benadryl.
I don't have access to EpiPens because they're super expensive and they have a pretty short shelf life.
Sure.
That's just, you know.
Sure.
Yeah,
they do.
aren't they like $200 and they expire after a year?
So the expiration date's a little bit, you know, fudgy, but yeah.
Right. Okay. And that's the only reason I don't have an. I'm not allergic to anything that I know of, but that's just why I don't carry one. Is because, you know, they're cost prohibitive and they have a very finite, you know.
So in the EpiPen, there's the little deal there that says that if it is, you know, discolored in any way, if it's not clear, then it's no good.
Okay.
Okay.
So there's that.
Okay.
That's my kit, and there's a light in there, there's a pen in there, there's a marker in there, you know, there's also a laser pointer in there.
Now, why do you carry a marker in yours? I know why I would carry a marker in mine.
For multiple reasons. Anytime you apply the tourniquet, you want to make sure and mark that time that you apply that tourniquet, because that actually, so there's a thing called compartment syndrome that can happen whenever you have decreased perfusion of that limb or whatever it is that you've applied the tourniquet to. So they want to know what time that you've had that tourniquet, how long that tourniquet's been on, to reduce the likelihood of compartment syndrome, mostly.
All right, Mr. Brad.
All right. This
There
one
we
is
go.
mine. Mine's in the Honor Tactical IFAK pouch. I've had this thing for years, and it's pretty excellent. On top, of course, I have a cat tourniquet too.
I love that tourniquet.
That is a sweet tourniquet, man.
This thing is awesome.
I love that you have it ready to go too.
And it's ready to go. And I'd like to point out, it has a metal bar
spindle,
here. Yeah. So you don't have to worry about cranking on that and breaking it.
Because you want to crank down. You want to crank down until they're screaming.
Yeah, exactly. So, and I keep that right on top, so I don't even have to unzip this thing to get to this.
Okay. Okay. Yeah.
Because it's like, you know, if you need to use this, it's life and death.
One-handed.
Yeah.
On the outside, I also keep a carabiner just because carabiners are useful. So.
Oh wow.
Yeah, wow.
Look. Wow. Oh man.
So.
All right.
I have some sterile gauze pads, some Q-tips, and some surgical tape in here. And then I also have some loose gauze, which isn't sterile, but
It's great. This right here, that is absolutely something that everybody should have.
Okay.
yeah. These scissors for cutting garments and bandages
You
and
have to
whatever.
expose whatever it is that you're looking at. Yeah.
Exactly. I have Israeli bandage, a flashlight. I have albuterol sulfate because I have asthma. But even if you don't have asthma, this stuff can open your airways if you're starting to have an allergic reaction.
Bronchodilator, sure.
Yep. Although this does require prescription.
Yeah.
I have an emergency poncho,
Okay.
which is just plastic. You know, I mean, it acts as a poncho, but it's also just plastic for whatever else you need. I have zip strips.
Very nice.
Oh, okay.
These are super slick.
That's the same thing that I had.
Yeah.
That wound closure kit. Yeah.
These are super slick. You got a big gash, you put this on there and you zip it shut, and it holds that wound together.
That's one thing I forgot to say that I also have.
You have those too?
Yeah.
Okay.
Oh, I also have sutures.
Oh, okay.
Oh, right on.
All right.
Right on. Oh yeah, and butterfly bandages?
Yes.
Yeah, those are
Butterfly
handy.
bandage. I could have swore that I had some zip strips in here too, but I guess I don't. Rape whistle though. You can't go wrong there.
I have a chemical cold pack,
Very nice.
which is handy. You just squeeze this and pop the little chemical bag inside and it gets cold. I have a burn dressing.
Okay.
That's great.
Yeah.
Hemostatic gauze.
He's got it. He does got it. Okay.
Quick
All right.
clot. Now we're talking.
Quick clot. This is some good stuff. You can actually buy this on Amazon.
Okay.
Yep.
I have
Man, I feel like you're more well prepared than I am.
Benadryl cream, triple antibiotic ointment, which is basically just Neosporin. And then I have burn cream and pain relief cream all in there. I have a bunch of moist towels, which is, I have sting relief, alcohol pads, and BZK towelettes, which is like a sterilizing type thing. And then I have a bunch of Band-Aids, different sizes, you know, from really tiny all the way up to like your standard size. I think I have a couple really big ones in there too. Zip ties.
Zip ties.
Because they're just handy, you know, for whatever. The other thing is I have an eye wash kit. So this is just saline in a bottle.
He was pretty proud of that.
I'm pretty proud of that.
Yeah, so my IV flush is basically
It's the same thing, yeah. And then I have this eye wash kit came with a little cup.
Beautiful.
For your
I
eyeball.
cannot remember what these are called, but these are great.
I don't know what they're called either. I have these are my drugs.
Yes.
I've got acetaminophen, ibuprofen, Benadryl, and then these ones in the blister pack are anti-diarrheal. So when you're out in the out in the woods, you get the runs.
Yeah.
That'll help you.
Very nice.
These are all over the counter.
I'm so proud right now.
I have a razor blade and some safety pins, just in case.
You're pro?
Ear protection. Yeah, I have some earplugs in here, just one set. And then
Matches.
yeah, windproof matches.
Okay.
I am so proud.
All right.
Oh, thank you, thank you. So the reason I have this set up like this is because I take this everywhere I go, and in my the area that I work, I deal with chemicals, and so that's why I have like the eye wash, because if you get chemicals in your eyes, that's a thing. And then all the other stuff is for, you know, everyday trauma and hiking stuff.
Very nice. I am absolutely proud of Brad's kit here. This is great. The eye wash, you know, my little normal saline, it will work fine for eye wash, but you have kind of gone over and aboard with that, and that's great.
Well, but it's because that in my line of work, this is more common than just an everyday person.
100%, yeah. The fact that you have trauma shears, that's another heck yeah, because you have to expose the wound no matter what it is. There's multiple ways of doing that, of course, but having trauma shears is beautiful. You have the albuterol, of course.
Yeah, and that's mostly specifically for me. But
Which is, absolutely perfect.
And for me, get some hemostatic gauze.
Hemostatic gauze, I would say.
Yep.
Yeah, other than that, I'd say you're pretty well
Yep. Okay.
prepared too.
Cool.
Yeah, and all of these are going to be for pertinent life threats, right? Like these are going to be to get you to a higher level of care. Like no matter what it is, like you're going to want to get to a higher level of care, and that's what all of us are prepared for.
Final thoughts?
make sure that you have some sort of personal first aid kit that you take with you out in the field, or even just like in your vehicle, or, you know, in your home. I mean, in your home, you have a lot of storage space, so you can have all sorts of stuff. But even just little things like when I'm on the job and I accidentally cut my finger, I have a Band-Aid available.
Sure.
Or, I get a bee sting, I have sting relief stuff available. Or like the reason I carry burn stuff in here is because I have burned myself on the exhaust
For sure.
on my pressure washer while out on a job. And, you can either suffer through it or you can put some burn cream on it and it feels much better.
This eye wash right here will also help with stopping the burn too.
Oh, I didn't know that. Just a saline wash will do that?
For sure.
That's good to know. All right. Ian, final thoughts?
Yeah, guys, no matter, this is kind of a big deal for us because we're getting positive criticism, right? So we have somebody here who's got a lot of medical knowledge, and keep your what's the word I'm looking for? Arrogance. Keep your arrogance out of the way, right? Like we're trying to learn. He's got more experience than us. I'm not offended. I want my med kit to be good. I want it to be, exactly set up. So I'm taking these ideas that I've learned from Kevin and from Brad, and I'm gonna input them into my med kit. Leaving the arrogance at the door. That's what this is all about. And I'm extremely thankful for you giving me this information because again, it's stuff that I didn't even think about. You know what I mean? And so
I'll tell you one more thing that a lot of people don't think about. Sometimes whenever you come up on somebody, I carry Sour Patch Kids, and people think that it's weird. But sometimes you'll come up with somebody out in the woods and they're having a panic attack. They don't know what's going on. They're panicking. The sour from the Sour Patch Kids will kind of help.
Interesting.
Reset.
Yeah.
That.
Huh.
And the sugar would be good
for
would be good for hypoglycemia.
It is.
But no, man, that's get out and talk with your friends and find out what kit they have and try and learn from somebody who has more experience than you do, because that's the only way we're going to learn is to seek out those who have more experience in a specific field than we do. On our way up, we were talking, this was a 2-mile hike or whatever, where it's like each one of us has a different experience and has different, things. And that's what makes us a good team, is that we all have different, we can help draw on each other's, experiences, and we can help in the lacking, and we can, just push forward. So yeah, get out there, talk with your friends, find out what kit they have. And, you might find out that you're severely lacking, or there's something in there that you just don't need.
Mm-hmm.
I feel like we complement each other very well.
Yes.
Definitely.
Everything that we have in all of our kits. I carry a fishing pole, so.
But I also feel comfortable that if we go out on a day hike like this and something happens, I'm going to be in good hands. I trust the guys that I'm going out and doing stuff with, and that's that's pretty much it.
Yeah. So, put down in the comments what is in your med kit.
What we're lacking?
Yeah,
what do you think we're lacking?
What do you think we're lacking? What could we add that would improve our kits? Or maybe you think that we're a little overkill on some things. Put that down in the comments too.
I think get out and touch some grass.
That's right.
Yeah.
Get out and touch the grass, man.
Touch grass.
Touch it.